What do we think of cold therapy? Do we like it? Do we want to learn more? Let's talk about cold therapy as a management tool for women with endometriosis. Don't mind the red glow, I'm just getting some red light therapy in. With my new red light panel that I'm testing out for me ladies that are curious, getting some lower back treatment in. Back to the cold. I have endometriosis. I hated the cold until I tried cold therapy and experienced the benefits. But cold exposure, whether that's cold plunging, a cold shower, or cryotherapy, won't suit everybody. And there are recommendations on how to do cold therapy as a woman. So let's get into it. Cold therapy is exposing your whole body or parts of your body to cold stimulus, whether that's cold air or cold water, for a period of time, typically 3 to 5 minutes, to trigger biochemical reactions in the body. So what are these reactions or so-called benefits of cold therapy? It reduces inflammation, like my red light friend here. It does this by narrowing blood vessels during exposure, which is followed by the widening of blood vessels post-exposure, which results in improved blood circulation throughout the body. Regular cold exposure strengthens the immune system by improving your immune response, helping you fend off illnesses more effectively. It enhances recovery by reducing muscle soreness and speeding up the healing process after a workout. And it stimulates the release of endorphins and norepinephrine, which improve mood and mental clarity. It's also said to reduce symptoms of anxiety and depression and decrease pain perception. Sounds amazing, right? But how do we attempt cold therapy as women? And does it help or hinder endometriosis? My go-to reference is Dr. Stacey Sims, who's spoken widely on this topic. She's a research scientist and expert in female physiology. She shares that women don't need to go as cold as men because by doing so, we experience a much higher stress response in our bodies, causing it to go into a shutdown phase. Generally speaking, cold plunge water temperature is between 4 and 5 degrees Celsius in order to trigger the benefits mentioned earlier. However, Stacey Sims advises that women will find 14 to 15 degrees Celsius more suitable and effective for their physiology. Additionally, because of our higher stress response, cold exposure might not be suitable for menstruating women in the late luteal phase. During the late luteal phase, we need to maintain our progesterone levels. A stressor, like cold exposure, can increase cortisol, which may lower progesterone levels, causing hormone imbalances. Now, when it comes to endometriosis, in a podcast, Dr. Stacey Sims referred to a study where cold exposure has been found to be helpful either during or straight after ovulation. This is because, apparently, cold helps to reduce the body's inflammatory response during ovulation, which leads to a reduction in the growth of the endometrial lining and, as a result, dampens the growth of endometrial-like tissue outside of the uterus. Very interesting. I also recently came across a pilot study by the University of Adelaide, which explores how cold water immersion and breathing techniques may influence inflammation, pain, and overall resilience in women with endometriosis. So that's what we know so far on cold therapy for women, and cold therapy for women with endo. Very little I know. Because of that, personally, I take everything on board when it comes to research, but I'll always come back to the fact that we're all individual. And the only way to find out what works for you is to test and learn. So I started cryotherapy about 3 months after my surgery. Cryotherapy blasts cold air in a chamber, as opposed to cold water that's used in plunges. Temperatures go down as low as minus 90 degrees Celsius. Yep, a lot colder than the 15 degrees you might say. I first tested it during the follicular and ovulation phases only. I built up some resilience and started to test it during my luteal phase. And then, whilst on my period. That's right. I became addicted. I kid, but maybe. Anywho, this is what I found. It helped me recover after exercise. I had better energy levels after a hard workout. It improved my focus. I felt clearer in the head. Sometimes I would pair it with whole body red light therapy. That combination honestly felt like a dream. Really helped put my body into the parasympathetic mode. As for endometriosis, if I did it closer to my period, so in the late luteal phase, it helped with my endo pain symptoms. It knocked out my shoulder tip pain. It numbed any cramps. I honestly felt lighter, which is pretty interesting because, as I said earlier, it's not really advised during the luteal phase. However, if I did cold therapy in my luteal phase, especially late luteal phase, so the week before my period, and I didn't do it as is advised, which is early in the morning or early afternoon at the latest, it affected my sleep. It left me feeling so alert in bed, which I imagine is because it increased my cortisol levels. So lesson learned there. And that's the gist of it. I kind of like it. I feel like it worked for me. I feel like when it was paired with red light therapy, it did help reduce my inflammation on another level. But that's enough about me. I'd love to know your thoughts. Have you tried it? If you're menstruating, at what point in your cycle do you use it? And what's been the outcome? And for those that are like, what the hell is that red light device? You've mentioned red light before. We want to invest. It's Black Friday promotions. Now's the time. Tell us. Have only just started using this device. So far, I absolutely love it. I will be sharing more about it, about red light benefits for endometriosis, because for me, it's been such a core tool. But for people that are already sure they want to invest in a red and near infrared light device, then the one that I'm trying out is by Bond Charge, and they actually have some of the best technology out there on the market. They are reputable, and they have a really good Black Friday sale on. So if you're super keen to get your hands on one right now and to take advantage of the sale, then head over to my profile, tap the link in my bio and have a browse.